According to
Gutierrez.
et al., resistance training can be an effective intervention strategy to improve walking and functional mobility in moderately disabled persons with MS. Because it can increase the gait kinematics, we thought it'd be a good way to improve function during gait. For this reason, we decided that our strengthening would focus on the quads, so we would do some step-ups and step-downs, utilizing both concentric and eccentric contractions to strengthen the muscle. Okay, so what we're going to start with is doing some step-ups and some step-downs, because we want to try to get your quad muscles stronger, okay? Because that'll help you pretty much with anything you try to do.
Okay.
So we're going to go ahead and step up to the step here. I got you. So what you do is I want you to step up with your left foot and then down with your right foot. So step up with the left and bring it up. Good. And I'll go down with your right foot. And good. Try to go down nice and slow. We're going to do 10 of those, okay? So that's one.
Okay.
So
Right foot.
left foot up.
Left.
Up, push. Good. And now come down with your right foot. Good. And try to bring that right foot straight up if you can, okay? Scrum. Back down. Okay, up with your left. Down with your right. Let's do 5 more.
Okay.
Up with that left. That's okay. Well, there we go. And down with your right. When you bring your foot up, you're kind of swinging it out, but try to bring it straight up to follow your left hand if you can. So go ahead and go up with your left. Bring that right foot up. Okay. Oh, you okay?
Ooh, I'm good.
Now down with your right.
Now it's not so good.
That's okay. We'll work on that in a minute. Up with your left. Down with your right. Let's go ahead and switch legs.
Okay.
Go up with your right, and then down with your left. Down with your left. You getting tired at all?
I'll get fatigued a little bit.
A little bit. I thought you might be. We could just do a couple more, and then we'll take a break, okay? So let's go up with that right foot.
Okay.
Very good. Down with the left. We're okay?
Yeah.
Can you give me one more?
Yeah.
Okay, let's try to get one more. Up with the right. Down with the left.
Whew.
According to Catania et al., balance rehab can be a useful tool to reduce the fall rate and improve balance in MS patients. It's important to focus on exercises in different sensory contexts that can have an impact in improving dynamic balance, which is very important during gait. For this reason, we decided to choose several different balance exercises to try to work on the different systems. That is why we'll see the patient working on foam pad, working on ankle strategies, and working on some exercises with the eyes closed. Balance problems. So we're going to try to do some exercises to try to maybe make your balance a little bit better, okay? So there's a lot of different ways we can stress your balance system by taking away certain aspects of it. So the first one I want you to do while you're standing here, I just want you to try to stand and just look straight forward, and I want you to try to close your eyes. And just keep them closed. I'm getting where I have you right here, okay? So just try to close them. I'm right here if you need me. Just stay as still as you can.
How long?
I'm timing. We're going to try to go for 15 seconds. Doing great. And open them. It's probably pretty tough, isn't it?
Yeah, like looking a little better.
Yeah, our eyes really help us, so make sure you have night lights and stuff at your house that'll help you see at night. So now what I want you to do is bring your feet a little closer together, and we're going to try to stand with one foot not directly in front of the other, but just out in front of the other a little bit, because that's going to throw off your balance some too, okay? Just do the best you can. I'm right here. And just try to stand. You feel like you have your balance pretty well? There you go. Now try to stand just like that. It's okay. I'm timing you, don't worry. Okay, you can just relax. Feeling okay? Getting tired at all?
Okay.
Feeling okay? Now the next one we're going to do is we're going to step on this foam pad here in a second. That's going to take away your joint receptors so you can't really sense what's going on there. It's kind of like if you're walking outside or in grass. We need you to be able to do that too, okay? So I want you to just try to step on the foam pad and try to get your balance then. It's going to be harder than it looks.
Whoa.
Okay, try to get your balance. Just look straight ahead, pick a point, or just going to try to stand here. Doing okay?
Yeah.
You're doing great. Oh, okay. Let's go ahead and step off. Just step off right to the front here. Oh, that's fine. Very good. Oh, you okay?
Yeah.
Need a break?
I'm good.
Okay, we're going to do one more exercise to stress your balance. Now, don't laugh at me because I know you can do this. We're going to try to stand on one leg. So don't laugh.
Sorry.
So try that left leg first. So just I'm right here, and if you need me, you can put your hands on. Oh, my hand's right here. Just put your hand on my hand, just kind of for balance. Try to stand on that left leg. Try to look straight up if you can. That back straight. Good. So you're doing great. Okay, put it down. Now we're going to try the same thing on the right leg. You think you can try that?
Are you gonna be on this side now?
I'm going to come over there, don't worry.
Okay.
Do you think we can go ahead and do that?
Okay.
So my hand's right here. You just try. Don't put too much weight on it, but it's there for balance if you need it, okay? Try to look up. Find a point. Just stay nice and steady. See, you're doing great.
So it's a little better.
This leg's a little better.
Yeah.
I'm going to try to get your balance better and get these legs nice and strong, get you moving again.
I appreciate it, Sonny.
All right, you put that leg down. Okay, let's take a break.
Okay.
Work on some ankle strategies, okay? And those are going to help our balance some more. Because ideally, if we get pushed or stumble or anything, we can kind of catch ourselves with our ankles. We don't have to take a big step. We can take the step if we need to, but our first motion should be at the ankles.
Okay.
So all you're going to do is you're kind of going to try to keep your knees and your hips straight, and you're just going to bend your ankles and bend forward until your hips feel this, and then you're going to bend back until your shoulders feel the wall. And try not to use your hands. And try to just move your ankles. Oh. And try not to stop once you get there. So you just go to there and kind of catch yourself and then come on back.
Okay, just touch it like
So just barely touch it. There you go. Feeling good?
Yeah.
Do you think you could go farther if I move the chair, or does this feel pretty good?
Try it.
I'm just going to move the chair out a little bit, and you take a short step out. Just a little bit. Okay. Now, it's going to be a little bit bigger now. Feel a little bit back. Try to catch yourself. Good. Same thing. Try to catch yourself so the wall doesn't have to do the work. Oh, good. Come on back. Oh. That's okay. Let's do a couple more. So try not to use the chair and not to use the wall. So just go two there. Come on back. Good. Go back. Go forward one more time. Good job. All right, good job.
Thanks.
According to DeBolt et al., a resistance-based training program can be very beneficial for MS patients. It can increase strength, function, and mobility. For these reasons, we decided to do some exercises to try to strengthen the lower extremity, especially the quads and the hip extensors. Not only are these good for strengthening, but we can also work on improving the mechanics of the sit-to-stand, which will hopefully improve efficiency and make it easier for the patient to perform. Okay, so the exercise we're going to do now is we're going to do chair raises, which is pretty much you just practicing standing up. So that's going to do a lot of things. It's going to make your muscles stronger, and we can also try to look at a couple things and maybe get your posture a little bit better in your mechanics, which will make it easier, and hopefully you'll be able to do it more often then.
Okay.
Okay? So for the first one, we're just going to stand up. We're going to try to do it 10 times. So I'm going to try to stand up without using your arms, okay? Okay, now sit back down nice and slow. Okay, so now this time, you see how you bent way far forward? I want you to try to lean forward with your weight, but then stand more up, okay?
Okay.
So we're going to try that now. Okay, now sit back down and try to sit down nice and slow like you're sitting on eggs. Feeling okay?
Is that better?
That was pretty good. So let's try to do some more of those, okay? So go ahead and stand up. Try to look up. sit back down. Try not to use your arms. Do it. Push, 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 push. Good. Bring your feet a little closer together. Maybe not quite that close. Get your balance and then sit back down. That was a real good one. Can you give me a couple more? You getting pretty tired?
I can do a couple.
Okay, let me know if you want to take a break, okay?
Okay.
We're just going to try to do a couple more. Stand up without your hands. Oh. Okay, sit back down. You lean forward pretty far on me again. I'm getting a little tired, so let's just try to do one more real good one, okay? Try to make sure you're looking up. Lean forward and bring your weight, and then stand straight up. Okay, sit back down nice and slow. Great job. You can have a break now.
Okay, thanks.
According to Freeman et al., a core stability training program can be beneficial to improve balance and mobility in people with MS. For this reason, we decided to do some exercises to focus on core stability. That's why we worked on the exercise ball, to force her to use her postural muscles and hopefully improve core strength, postural stability that will be beneficial in the sit-to-stand process. Now we're going to sit on this ball because it's going to really work our core, okay? So I just want to try to sit straight up and keep a nice, good posture, and we're going to try to strengthen your core muscles.
Okay.
So all I want you to do is kind of lift this left leg up to about my hand, like a little march. Try to keep your balance. Whoop. Okay. Now try that right leg. Good. Now we're going to try to do 10 of them, okay? So that was 1, 2, so I'm going to try to do 10. You can take a rest if you get too tired, okay? You're doing great.
Not counting.
I'm counting.
Okay.
Don't worry. If we don't do exactly 10, no one will be in trouble. Okay?
Yeah.
You're doing awesome. Good. Okay, take a break. So now what we're going to do is try to do some reaching, okay? So what I want you to do is kind of reach out and like touch my hand with your left arm. Good. Now back. Now how about that right arm? Now pretend like something else was about the same place as my hand, but on that side. And try to do the same thing. Touch it with the right and then the left.
Like this?
Reach a little bit. Yep. And now come on back. Good. Now how about you try that with the left? Oh. Okay. Good. Now back to this side. Try to do one of each. Ah. Oops. You're okay. Try that left arm. Good. Okay, now how about now go the other way? Right and then left. Reach. Okay, good. How about that left? Great. You're doing awesome. Let's take a short break. You deserve it.
Thanks.
That's what we're going to do is while you're sitting here on this ball, you're going to try to put your feet on that yellow thing. It's going to make it really hard to stay balanced. So it's really going to work our core and make you be nice and stable, okay?
Okay.
So I'm right behind you. So you just try to put both legs on that yellow thing, and we're just going to try to sit like that. It's hard, isn't it? Okay, just try to keep your balance.
Wobbly.
Alright, it's okay. We're really working on those stabilizing muscles. Doing good. Doing good. You feel okay?
Yeah.
See, I bet you didn't think you could do this, did you?
It's not as bad as I thought. This is working my tummy.
It's working all those core muscles. Yep, right in the tummy. Gonna give you a nice flat six-pack. Okay, take a break. Step off. Oh, good job.